Hello and welcome. Australians are currently losing their right to choose how many vaccines they use in their own body. And this is occurring without informing doctors or consumers what is in the vaccines that are injected into the tissues. The government is doing this by claiming that vaccines controlled infectious diseases, and it therefore claims that unvaccinated children are a danger to the community. This claim is not supported by the historical evidence of the decline of infectious diseases in any developed country. And this is stated by all the prominent public health officials in Australia during the 20th century. Infectious diseases have been controlled by environmental and lifestyle factors that the World Health Organization refers to as the social determinants of health. The decline in these diseases occurred by 1950 in developed countries due to public health reforms, not a medical intervention. Evidence for this fact is provided in these quotes from prominent Australian public health officials. Firstly, Professor Fiona Stanley, the Australian of the Year in 2003 for her contribution to public health. She made the following direct quotes in the 2001 document titled Child Health Since Federation. Firstly, she states infectious deaths fell before widespread vaccination was implemented. And also, quote, the rates of infectious diseases in Australia were very low from 1950 to 2000, and the majority of the fall in the under 5 mortality rates, 80%, had occurred by 1960. Prior to the introduction and widespread use of the majority of vaccines. And another quote, at the beginning of the 20th century, infant mortality rates to infectious diseases were very high, but they declined rapidly as environmental and host characteristics changed due to improved social circumstances, education, and income levels. And lastly, quote, despite the voluntary nature of vaccination programs from 1953 to 1990, Australia had very low rates of mortality and morbidity due to infectious diseases. The infant mortality rate in 1990 was 8.2 per 1,000 live births. This clearly shows that herd immunity created by vaccines was not the reason that infectious deaths declined in the first half of the 20th century. The push to increase vaccination rates to 90% and above occurred after 1990, and it occurred despite the fact that measles, whooping cough and influenza were removed from the National Notifiable Disease List in Australia by 1950. They were removed because they were no longer considered to be diseases of serious concern to the majority of Australians. This was the same in other developed countries. A vaccine for measles was not introduced until 1970 in Australia, and then it was introduced to see if measles could be eliminated, not to reduce the deaths and illnesses to this disease, because that had already been done. There were still cases of these diseases in the community, but in the majority of cases they were mild and self-limiting, and they provided long-term immunity and protection for the community. The term herd immunity was first applied to the community protection obtained after natural exposure to the organisms, when the risk of death and illness to these diseases had been removed. There is no evidence that vaccine-created herd immunity exists, because vaccination coverage was always voluntary up to 1990, and vaccination coverage had never reached levels of 90% or higher prior to this time. In 1956, public health officials such as Lancaster stated, and I quote, as causes of infant mortality in Australia, all the infective diseases have been overcome. And another quote from Lancaster, from 1946 to 1954, whooping cough was an uncommon cause of death for children, and there is a significant decline in mortality if the age of infection increases. And lastly, he states, mortality rates, that's deaths, due to whooping cough, are used as an index of hygiene or social well-being. In other words, whooping cough disease is only a serious risk in communities where the environmental and social determinants of disease have not been addressed. A vaccine for whooping cough was not used in Australia until 1953, after the risk of death and illness to this disease had been reduced. Australia's most prominent public health official of the 20th century, John Cumpston, Australia's Director General of Health, stated, "The decline of infectious diseases in Australia occurred at the same time as the period of sanitary reform and prior to the introduction of most vaccines." Whilst the government claims that vaccines are necessary for creating herd immunity, it does not use this criterion for approving a vaccine on the National Immunisation Programme. Terry Nolan was the chairman of the Australian Government Vaccine Advisory Board from 2005 to 2014, and he states that proving herd immunity, quote, "is neither necessary nor sufficient for a positive recommendation on the National Immunisation Programme." In other words, the government does not have to prove that a vaccine can create herd immunity in order for it to be approved, yet it is promoting vaccines to the public as being essential for community protection, and that it is our responsibility to protect the community by getting vaccinated. The government also states that unvaccinated children are dangerous, yet the government does not provide any evidence for this statement, and it is removing our right to choose how many vaccines we use based on this unsupported claim. These quotes from all the public health officials, including our Australian of the Year for Children's Health, Professor Fiona Stanley, clearly demonstrate that unvaccinated children are not a danger to the community, and until the government provides transparency and accountability in this policy, there is no justification for any coercive or mandatory vaccines in government policy. Thank you for listening.